This is a training video for front office assistants and medical assistants. Even though you are not a doctor and cannot diagnose a patient, you still play an important role in the personal care of patients, and it is your responsibility to be observant of interactions in your workplace that may impact the health and treatment of all patients. In this video, we will show you some ways to identify signs of possible domestic abuse, as well as appropriate and effective ways to respond when you observe these signs.
Next.
Situation number 1.
Hello, how are you? And do you have an appointment today?
Yes, she has an appointment today.
Great, can I just get your ID and health insurance card, please?
Oh, I have them. Here are the NEMS. Here's her ID.
Thank you. Okay, so what would the doctor be seeing you for?
Oh, she's just having a normal checkup.
Oh, okay, great. Can you please fill out this form and we will call you when the doctor is ready to see you.
Oh, I'll take those.
Oh, okay.
Thank you.
Did you notice any signs of possible domestic abuse? Let's watch the scene again.
Hello, how are you? And do you have an appointment today?
Yes, she has an appointment today.
1. She is reluctant to state reason of visit.
Oh, I have them.
2. She has no access to her own ID card and health insurance card.
ID.
Thank you. Okay, so what would the doctor be seeing you for?
Oh, she's just having a normal checkup.
3. She defers to her partner
Okay,
to answer
great.
questions.
Can you please fill out this
4.
form and
Partner
we
jumps
will
in to
call
answer
you when
questions
the
for
doctor
her.
is ready to see you.
Oh, I'll take those.
Oh, okay.
Thank you.
5. Partner follows patient everywhere. If you notice one or more of these signs, what should you do? How do you react appropriately and effectively if you observe one or more signs of possible domestic violence? Front office assistants should alert the medical assistant to do the domestic violence screening. Situation number 2.
Sandy Lee. Hi, Miss Lee. Good morning. You can come in with me. Oh, Mr. Lee, you can stay at the waiting area. We'll be seeing Mrs. Lee by herself.
Oh, she says she wants me in there with her.
It's our clinic policy that we see our patient alone.
I need to translate for her. We always go in together.
It's our clinic policy that we see our patient alone.
She has really bad hearing. I need to be in there with her.
How do you further respond to the partner's insistence to join the patient? Let's watch this scenario again.
I need to translate for her. We always go in together.
It's our clinic policy that we see our patient alone.
She has really bad hearing. I need to be in there with her.
Oh, I'm sorry, Mr. Lee. We understand your concern, but it's important for the doctor to spend some private time with the patient. We have interpretation service available. If we need assistance from you later, we'll call you. Mrs. Lee, please come into the room. Right here. Yeah, please come into the room. The visit usually takes about 20 to 30 minutes, and if you want, you can go for a walk and come back.
For medical assistants, if you are alerted by front office assistants to do the domestic violence screening, you can directly ask the 4 designated screening questions in the exam room. These questions have been tested to be an effective screening tool.
So I'm going to ask you a set of questions regarding domestic partner abuse. We ask the same set of questions for many of our patients during their visit. Is it okay with you? Okay. So the first one is, are you currently in a relationship or have a partner for the past year? Okay. Have you been hit, kicked, punched, or otherwise hurt by your partner in the past year? No. Has your partner put you down, humiliate you, or try to control what you do in the past?
Situation number 3. As a medical assistant or front office assistant, you may feel something was not quite right in a situation and wonder, did I do enough? Did I miss any opportunity for intervention? Am I missing signs of a call for help? Should I be more proactive in engaging the potential victim to talk with me? You may fear retaliation or that you're causing additional harm to the potential victim, such as, what have I done? Did I contribute to further deterioration of the couple's relationship? Would the perpetrator retaliate against the victim? Would the perpetrator retaliate against me? What should you do if you have any of these thoughts following an interaction with a patient?
Hi, how you doing?
Oh, pretty good. Excuse me, do you have a minute to talk?
Sure, come on in.
Even if it turns out to be nothing, it's never a problem to speak up and bring this to the attention of your supervisor or a front office team leader. Your feelings are always valid to bring up. Your supervisor or a front office team leader is always available to listen to your concerns and provide support, because intervention is a team effort. You are fulfilling your responsibility by enforcing the privacy rule, by alerting clinical staff for further evaluation and assessment, and by being educated and informed about domestic violence and interpersonal violence. Let's recap what we have covered. As a front office assistant or medical assistant, you are in a unique position to observe signs of domestic abuse. These signs include attempts by a partner to control a patient's behavior, communications, or access to documents. If you observe any of these signs, it is your responsibility to do what you can to care for the patient. Depending on your particular role, this could include writing a note for the next caregiver, doing a domestic violence screening, or tactfully dealing with a partner in the waiting area. You also need to care for yourself so that you can continue to care for others effectively. If you have any feelings about an interaction or observation while working, do not hesitate to discuss these feelings with your supervisor or a front office team leader. Your work is very important, and you can be the first sign of hope for someone in an abusive situation who may feel scared and helpless about what to do.